Morning, welcome to day 2 of our Festival of the Future as part of Digital Leaders Week this week. I'm Sarah Dackham, I'm one of the digital business partners here at the Council. I've posted some festival rules in the chat bar. I'll post them again just in case you haven't seen them already when you joined. What we're basically doing is having a great conversation here with John Sloper from Help&Kindness. If you've got any questions you need to ask or you'd like to raise a comment, please do so in the chat bar and we'll pick those up as we go through. I think most people have joined us now, so I think without any further ado, I want to welcome John Sloper. Hi, John. Thank you so much for being part of the festival today. We met earlier this year as part of the community response to COVID. John's going to talk to us today about the Help&Kindness project and the role of digital in Dorset's community response to COVID. So without any further ado, it's over to you, John. Thank you.
Thanks, Sarah. Good morning, everybody. As Sarah said, I'm John. I'm from a project called Help&Kindness, and I thought if I just introduce that very quickly, then I can explain how we've been involved in the COVID response and some of the things we've learned along the way. I'm aiming to talk for about 25 minutes, if that's all right, and then we'll happily take lots of questions, which I hope will come from some of the things that I'm sharing with you. So Help&Kindness is a community interest project run by a community interest company, and it's all about bringing together information about the help that's available across Dorset. So it's all the small groups, the large groups, the public sector and the private sector all bundled in together so that people can find out information about the services that are available in their area. Dorset being a rural county, locality is key. We have some difficulties in Dorset with travel and things like that, and so knowing what's available in your village or in your town is absolutely critical. So all the information that we gather is locally plotted on maps, and as far as possible we can tell you exactly what's going on in your area if you search for something. So we started this project about 2 years ago, and just looking around to see what it was that would be useful to people. And this was a time when the council was going through its reorganisation, and there were a lot of people moving around in different jobs, and there was some concern that a lot of the local information and local intelligence about support would be lost as people were redeployed, or as they unfortunately some of them lost their jobs or got moved into other areas. And so we thought, well, perhaps we can bring that stuff together, that information that is contained in the heads and the little black books of the people that work in the communities, and put that all into some sort of project. Coming from a digital background, we reached for digital tools and have built a website which is called helpandkindness.co.uk, which gathers all that information together and presents it in a way that you can search and find the information about all sorts of different things. We wanted it to be really flexible, so we didn't want to say that we had the answer in terms of a data structure. We didn't want it to be just about mental health. We didn't want it to just be about carer support or cancer or children or adults. We wanted to throw the doors open and say, look, if you need help, you can find it on all sorts of different topics, and those topics might lead to other topics, and that people can follow their noses and say, well, I've got an issue with this particular thing in my life, but that probably impacts on other things. So unemployment impacts on mental health, impacts on housing, impacts on finance, impacts on all sorts of other things to do with family life and your personal circumstances. So we wanted to have this blended offer, and that's what we built. This was launched in November, and then COVID came along in March, and we were invited to join the county's Community Shield COVID response team, which was working in the community to gather together the information about the support that was available across Dorset. So probably most of you will know that response in terms of the volunteers across Dorset was phenomenal. Within a fortnight of lockdown, there was a complete system set up where people could phone into a number of phone numbers, helplines run by the council, by Volunteer Centre Dorset and by Age UK North, South and West Dorset. And you could phone up there and they would be able to give you help to get hold of shopping, to get hold of prescriptions, to help you with finding people to talk to if you're feeling isolated and needed someone to chat to, and even do things like dog walking for you as well. So that network sprang out of the grassroots. It came from so many people just feeling moved to do something for their communities. And there were thousands of volunteers that stepped forward. Across the county, there were over 120 different groups that stood up and set themselves up to respond to the COVID response in lockdown. They did things differently in every single location. So every place that there was a group, they ran their group slightly differently. And one of the things that we were doing in the mix was we were gathering information about those groups, how they were working, what they were providing, and how to contact them. And that information then was shared with the other partners in the COVID response team, so that when the calls came in, they could be directed to the correct local groups. That meant that there were thousands and thousands of support calls and people allocated to various different areas across the county. And they were all localised. So in pretty much every town and village across Dorset, there was a COVID support group. And some of those, when we looked into it, over 60% in fact, were completely new. They weren't pre-existing anyway. There were some that came from the churches and the parishes. There were some that came from existing Facebook groups, but the vast majority, as I said, over 60% of them had stood up as a completely new organisation, a completely new network. Somebody in the community had just said, I'm going to do something about this. I'll speak to a couple of people that I know. Can we put something together? And then they sprang up. So we gathered the information about what they were doing. And that enabled us to keep in touch with them. So as the groups changed and developed, we were able to bring in support for the work that they were doing. So through listing them on Help&Kindness, we were able to signpost the support to the right groups, but we were also able to take the information from the groups about what they needed to be able to deliver their services too. So that sometimes involved signposting them to funding so that they could pay for phones and printing and things like that, or it could be about DBS checks. And I noticed Izzy from the volunteer centres on the call this morning. They were able to provide very quickly DBS checks to enable people to go and work with all sorts of people in the community. The information flow being too was absolutely fantastic. It's really unique, I think, in local community response for this kind of information, this kind of connection to be so deeply embedded in the grassroots. And so we began to understand what these communities needed, and we began to put support systems around them. So whether it was giving them help with the DBS checks and so on, but also looking at how to recruit volunteers, to manage the volunteers, how to tie into the existing other networks that were around, and bringing all that information together and that communication together. And what the groups did, as you probably all aware, was completely mind-blowing. The stories that we heard when we started to gather information about how they were working are just breathtaking. And the ways that they ran themselves were equally really inventive, really smart, and completely appropriate. So the various groups out there, some of them had what they called a bat phone. There was one in Dorchester, and that was shared between a number of people. So any calls that came in came onto the mobile phone, and then they allocated the request through to their volunteer team. Some people had WhatsApp groups. Some people divided their community street by street, and they had a volunteer on every single street that would take the calls and be the responsible person if there was a need in their particular road. All these things used a blend of technology, personal contact, and other things like print, really old school stuff. The blend was really important, and when we came to look at how the groups ran and to see if we could learn from this as a kind of bigger piece of community learning about how communities run themselves and how they can be motivated to develop and support one another, we realized that it's a messy business. It's a really complicated scenario, and the thing is, we could never have planned for the things that happened. You couldn't have put in a process that was as subtle, as interesting, as blended, and as appropriate as the one that developed. So by giving the communities the space to kind of step forward and build up their own response, and then supporting that from the council and from the other partners that are in the Dorset County area support team, it meant that we got the best of both worlds. We had the best of the local with the best of the county-wide as well. And the amount of work and the amount of support that was able to be given was consequently just phenomenal. And there were some amazing stories. People used social media. They used Facebook a lot to promote what they were doing communities. Some of those got out into the big wide world, and we had calls from people from Japan, from New Zealand. We had people from Australia getting in touch through social media or through the phone lines saying, my relative, my mum, my dad, is struggling a bit. She's running a bit low on food. Could you possibly, find someone to drop in and check that she's okay and deliver some food to her? In fact, in one case, they said, oh, it's my mum's birthday next week. Do you think you could pop round with some flowers? Which happened and just made her day. So there's been lots and lots of examples where the networks that were there, the personal networks of people referring friends and so on, the sort of local authority networks with the central phone lines and the helplines, and then the social media plus print blended together to give an amazing level of coverage to the support that was on offer. Print is really important. We had some really interesting feedback within the conversations we've had with the group organisers. Almost all of them have used some level of print to get in touch with their communities. And this has been somewhat surprising, I think, because everybody presumes that digital is the thing and this is going to solve everybody's problems. But actually, it's been the print that has made sure that nobody falls through the net as far as we possibly can. So some of that has been organised just spontaneously by the local groups. Some of them were organised by the groups and then were funded by the council. Others were put in by the council and messages were sent out, for instance, to all the shielded people that were in isolation during lockdown. So there's a whole blend of things there, but the print story has been fascinating, particularly as somebody coming out of a digital background that I do. The print stories have been hair-raising, frankly, just in terms of how important the print has been. In Weymouth, for instance, an example was that a leaflet drop was put through all the letterboxes on a particular part of Weymouth. And within one of the feedbacks, which happened pretty much instantly, as soon as the letter went through the letterbox, was a phone call came in, and the gentleman who lived inside that property said, I'm absolutely out of food. Your leaflet has come through in the nick of time. I don't know how I'd survive if you hadn't got in touch. And that had come through purely through the fact that the print was there. He had no other means of communicating with anyone to get help. That isn't the only story. There are absolutely loads of those across the county that we've come across. And in many ways, what we've discovered is that by exploring how this response has kind of taken off, is that COVID has been a bit like the tide going out. It's revealed a lot of things in our society, in our communities that have always been there, but they're kind of hidden by the hustle and bustle of everything else that goes on. And what we discovered with the COVID response and listening to the local communities was the fact that these underlying issues really came to the fore. So things like isolation, people with mental health issues, people who are really struggling financially, really struggling in their communities. And this gave us a chance to identify those people and get alongside them in a way that was really straightforward, really appropriate. It didn't come from a kind of top-down view. It came from the bottom up. It came from people becoming more neighbourly with one another. And there's some wonderful stories. In Catterstock, for instance, one of the coordinators there asked someone to go and one of the volunteers to go and do some shopping for one of the residents in Catterstock, and that was duly done. They then bumped into that volunteer a few weeks later and said, oh, well, thanks so much for dropping around and seeing the resident and bringing her shopping. She said, oh, I've been doing it for the last 3 weeks. And that whole thing of this stimulating a new neighbourliness in our communities is something that's been reported across the whole county, and it's just so exciting. It's such a wonderful thing to have witnessed. So in terms of where we are and where this takes us in terms of understanding where digital fits into this story, and how we understand how communities are motivated to kind of respond and how they can be supported, it's given us huge new insights. It's an extraordinary opportunity for us to kind of learn new things about how people work together. And I think the things that come out from that are that when we work together, we need to feel safe. We need to feel that we've got right environment to work in, that we need to feel that we're doing the right thing, that we're being supported, we're being given permission, and that what we do is manageable and something that we can engage with safely, we can engage with and not be overwhelmed by. That safety comes from all sorts of different things, and I think within the COVID response, it came from the fact this was an emergency. It was really practical. People needed food. Well, actually, I could go round and drop some food round. People needed their medicines collecting. Well, actually, that's not difficult. I could do that. People needed a phone call or someone that they could lean on. Well, that's okay. You know, I can give my phone number and somebody can give me a ring if they need to have a chat. So really practical, manageable things. And so this idea of safety and building good ways of working then was supported by the way that the public sector and the private sector actually stepped in alongside that. So in the public sector, the community response team and all the people that were represented from Dorset Council, from Public Health, from the NHS Clinical Commissioning Group, and all sorts of other partners that stepped in to support in that effort. They were there as and when they were needed. So they weren't pushing through. They were there to support and step alongside and make people feel safe. So the DBS checks that the Volunteer Centre did, the support that the Dorset Community Action gave in terms of supporting the groups and helping them find insurance if they needed it. All these little pieces of the jigsaw fitted around what was going on in each of those communities, and no two community responses were the same. They all had different needs. So some of them had PPE, some of them had funding, some of them had training, support, management, and just a listening ear to help them with their management of their local community groups. In terms of the legacy and the next steps really off the back of this, obviously this opens up a huge window into how potentially we could work in a collaborative way, much more agile way, much more locally focused way of team working between all the sectors, all the interested parties, all the people that want to get involved in community work, community support. As I said, when the tide goes out, we're left with these somewhat intractable, in some cases, problems, and the challenge, I think, the opportunity that we have now is to tackle some of those problems in the same way that we tackled the coronavirus emergency response in the first few months of 2020. So it's looking at small steps, finding safe ways to motivate and inspire and respect what's possible within our local communities. And as far as the digital part of that story is concerned, and one of the things that we are working on currently, it's about trying to find the ways to build the communication networks that exist between all the different parties. And one of the things that is a challenge with that is the fact that we all are at different times involved. So we have some people are at work during the day and can only do things in the evening. A lot of the statutory services are only available during the day and not necessarily available in the evening. So there's a whole mismatch of kind of availability and opportunity there. But I think we can use technology in some parts of that to blend and join together the activities that exist between both parties or all parties. So one of the things we've built is a community forum into Help&Kindness, which we're using for the COVID response group community organisers, where they can post information, where they can share information about what's going on in their communities. They can share details about the questions and challenges they have, and that the partners can sit in that forum as well and listen and follow and support whatever comes up from the grassroots. What that has meant is that things like when we came out of lockdown, a couple of the groups were talking about how can we restart community transport schemes, taking people to hospital for checkups or taking people into town to go shopping or for other appointments. That was shared in the forum, and we had other groups sharing their peer-to-peer kind of responses to that and what they've been doing. And then we had input from some of the statutory partners about what's the best practice and how to manage things like safeguarding and PPE and so on. So it was a real blended response from something that came up again from the local community. So that network, we hope, is something that can support part of this recovery, this response, this next step for how these community groups can kind of work together. The other things that we're interested in are the fact that it's a two-way conversation. This isn't just about putting messages out there that are, telling people what to do. This is about people sharing ideas and insights from the grassroots. And there's another community group that we're also working with in one of our forums in Weymouth, which is about 40 local community groups. It includes the town council representatives as well. And they're basically looking at various different issues that are facing the communities that live in Weymouth. It has sprung up some amazing work. So off the back of that, there's now a food security subgroup that's working on the support of the local social supermarket that's about to open hopefully this month, and the food banks that exist in Weymouth, the potential for the community fridges that might be appearing soon, we hope, and the Tumbledown Farm project as well, which again is a community food project. So by bringing all these people together, we can start to amplify what they do, to support what they do, bring them into the attention of the public sector, through the council and other partners. So, public health in the food security issues at the moment across the county, and they can then start to interact, to understand what's going on the grassroots, and really engage with the communities where the communities are and at the stage at which they are, without setting the agenda all the way through, but just nurturing and bringing on some of these amazing projects that exist across the county. So I'm very aware of the time, and I've been speaking for a little while now, so I'm just going to pause on this just to say that I think that digital is only part of the solution, that we need to recognize and dovetail with other things, the face-to-face, the personal, the print side of things, and that the best responses that we've seen through the COVID emergency response has been people working together, people rolling up their sleeves, being pragmatic, and being really focused on what the community needs and what the community can do. And I have to say, it's been an absolute privilege and an honor to be part of this whole piece of work, and it's been a pleasure sharing it with you this morning.
That's fantastic. Thank you, John. I don't know there's many questions in the chat bar. Lots of good comments in the chat bar so far. I don't know if you've had a chance to see. Amazing stories. Helen's been tweeting. Alex is raving about the stories. And there's great news about the social supermarkets and community fridges, which, as you probably know, is quite close to my heart anyway. If anyone's got any questions right now, please feel free to either pop your mic on, put your hand up, or stick something in the channel. We've got a little bit of time available to take questions if anyone's got any. That deathly silence. While we're just giving people a chance to think, the one thing that I think is really coming out of these sessions at this festival is that it's not just a digital solution, and digital is just part of the solution. It's really about people and people pulling together in whatever session you're listening to this week. I think that's a theme that you'll really hear coming across loud and clear. Katrina's just put a fantastic question. Do you want to say that one out loud, Katrina? She's there. I know she's there. She's been tweeting. She's saying, how on earth do you find the time
Sorry,
to...
I'm
there you
wrestling
are.
with 2 headphones, 2 screens,
I can
tweeting,
imagine.
copy pasting, sniffing, and all the rest of it. Yeah, John, how on earth do you find the time to do all this? It sounds amazing, and I know you've got people, but I know what it's like to be at the centre of masterminding an operation like this, and it's awesome. So well done.
Well, thank you. It would not be possible without the support of my family. My wife's on the call. Would give a shout out? Thank you for being so patient. It's definitely a team effort. But I think the thing that has been just such a sea change has been the fact that not one group or one organisation has felt the need to do everything, and so we all do a bit of the picture, and we all share the bits that we're capable of doing, and then we rely on each other to do the bits that they're specialists in. So the teamwork and the seamless kind of way that this has worked is really unique, and I think it has been something that has inspired and really challenged this thing which you know, the kind of business as usual, which is the temptation to kind of go back to the old ways. I think it stands in a really stark kind of challenge to that, and that if we trust one another more, if we find ways where we can make it safe to work together, then all sorts of things are possible. We can behave in a much more agile, a much more kind of trusting way with one another. And from my point of view, that's been one of the big parts of our capacity to do this work, is that we haven't had to do it all. We've been there to kind of be the glue between parts of this amazing response, and be able to sort of develop solutions that have supported everybody else. And that's been an absolute joy.
I definitely second that, having worked with you for the last few months. Some more questions popping up in the chat. I don't know if you've seen, John. Gail Barton's got a question that relates to the trust. Gail, would you like to read your question? Are you happy to pop your mic on?
Thanks. Yeah, sorry, couldn't remember.
That's all right.
Yeah, I know trust has been a problem with some people's willingness to engage with the pop-up services, especially those who were already in the situation of isolation and low sort of digital engagement. Is that something that your groups saw, and how was that developed to the best effect?
I think that the difference that happened with the groups is that those groups emerged from the communities, so they were already people who were involved and known to the local communities too. The idea that people dropped, you know, postcards and letters and notices through people's door saying, "This is Jenny, I live down the road," or this is our team, this is Mike and Fred and Julia, and we're all doing this work together, and we live in such and such. You know, I think it gave people a sense of, you know, this wasn't them having stuff done to them, this was neighbours being neighbourly, and it took an awful lot of that anxiety away from the that initial reach out to ask for help. Obviously, there were some people that absolutely needed to ask for help, and it was just that was the only way that they could get it, and so that kind of was a kind of necessity in that instance. But for those where it was much more subtle, I think that the fact these were people, just ordinary people that lived in their communities already, made a big difference. The fact that they were supported by then the council and all these other organisations helped with building credibility and helped with people's kind of reassurance. And when we had instances of people who had you know, other vulnerabilities or special needs or had were needing more sensitive, more specialist support, then there was a whole team standing by who could offer that, and so that involved the safeguarding teams within the council. It sometimes involved welfare checks by the fire service. There were all sorts of things that could then be brought in if they were needed, but that trust piece was largely down to the amazing people in the villages and the towns who stepped forward and used their personal connections, their personal friendships and neighbourliness to kind of build those relationships.
That trust was a huge part, and I think that it was people first all the way, and whatever people needed, there was a massive group of support behind that that we could then tap into, rather than it being the top-down way that we might have done things previously. And I think that's what's really made a massive difference in Dorset. There's lots more questions coming through, John. I don't know if you've seen, if I whiz you back up to a couple at the top. Richard Thomas has asked if there are any community fridges in South Wales. Do you know that?
I don't have any information about South Wales, I'm afraid, Richard. There are networks, I can post some links and so on about the community fridge movement, but I don't know anything specifically about South Wales, I'm afraid. But we are very excited about the number of community fridges that are happening. Just for those who don't know, those are places where short-dated food that normally would go in become kind of a waste and go into landfill and so on, can be put into literally a fridge that sits in a place that the community can access it. So it could be for either your own surplus, where maybe you've got things that you can't use up in any given week, you can pop them in there and the local community can access them, or it comes from shops that have, again, kind of short-dated food. It's much more about fresh whole foods than it is about kind of long-dated foodstuffs that you might get from a food bank, for instance, and it's accessible to the whole community. There is no kind of restriction on accessing it as you get with a food bank, where you might have to have a referral from Citizens Advice or from social services and so on. So it's a really wonderful community resource, and it's something that often spins up other projects, and they're hugely exciting.
They certainly are, and I think you'll see further down the chat, if you haven't seen that already, there are some more links that the team are popping in there to find out more about community fridges in different parts of the country. So thanks for doing that, guys.
Brilliant.
We've got some more questions here. How was Help and Kindness funded? Not sure you covered that too much.
Okay. We're funded through three things, actually. The first thing is that we apply for a small number of grants. We're a community interest company, a not-for-profit social enterprise, and so we've applied for a number of grants to help us get some of the work that we've developed done. We're also supported by some amazing personal and business sponsors who donate money to support the project, and we're hugely grateful to them. Then we also have traded services. So there are some situations, as with the COVID response, where the council were able to support us with some investment to enable us to do this work as part of the community response. And it's a real blend of all those things. So although we're involved in the community response very heavily at the moment, we're also involved with the CCG around their dementia services review, the mental health review that's going on at the moment, a whole plethora of different projects that are going on in the county, where local information about community activity, community services, community help is really important. So things like social prescribing are very much part of our agenda, our landscape at the moment. So those three things, basically, that's how we get by. And yeah, we're never quite sure what's coming around the corner, but thankfully we've been able to keep going and keep supporting. So that's great.
Brilliant, thank you. Helen's got a question. Helen, I know you're there. Do you want to pop your mic on?
Hi, John. Hello.
Hi.
Sorry. Hello. Yeah, I was just wondering how you accessed ethnic minorities, and whether that was really challenging.
Yeah, hi Helen. Yes, it is challenging, and we worked within the community response. One of the partners is Dorset Race Equality Council, and one of the things that they identified very quickly was that when lockdown happened, it became quite difficult to contact and stay in touch with a lot of the ethnic communities, minority groups across the council area, particularly actually those that are in rural communities where there's a kind of it's much more difficult to find ways to get in touch. So we did a very small project. I won't overblow it at all, but we did a very small project of reaching out through the community response groups to try and reach those communities that aren't part of the the traditional kind of white British mainstream in the county, and we shared with them the details of Dorset Race Equality Council, so that if they needed specific support or they're having specific issues, then they could get in touch with DREC. And we found that the reporting from DREC was that they'd had more calls as a result of that piece of outreach that we did, and that they were able to provide specific support to some of those people living out in the rural communities. It's something that we're working on as part of a print project that we're doing currently. You can find information about all this on our website, on our news pages. And the idea is that we need to have a much more blended approach to how we approach the minority communities. So we need individuals that we know will be able to share information and be a kind of link point. We need to be in touch with people in the places that they live and work. And we need to be a lot more challenged by the minority communities to be more inclusive and to be more actively involved and engaged with them. And the COVID response was a little scratch on the tip of the iceberg of what that might look like. So we're looking to push forward on that as part of our work with Help and Kindness in the next few weeks and months.
Fantastic. That's brilliant. Thank you, John.
I think that's all the questions we've got at the moment, unless anybody's got any other questions. If you've enjoyed this session, there are more sessions on a similar theme today, just getting a quick plug in there for other tents. We'll be in another tent later on at 11:30 with Councillor Peter Wolf, who's the Deputy Leader of Dorset Council, and John Selgren, who is our Director of Place, and they are going to be talking about more about Dorset's response to COVID and what the future's looking like going forward. So if you are around to join us for 11:30, we'll be there in a different tent then. I can't see anything else popping up on the chat. She says, just scrolling back down again. Can't see anything else. I think, oh no, there's more. There's more at the bottom. Helen is saying, I think it's brilliant you're providing pathways for people in need, not just about fixing one thing, but helping them to help themselves. I completely agree, Helen. I think unless you've got anything else you'd like to say, John, or to add in there. Thank you.
I'm very happy. Thank you very much for this opportunity. And if anyone would like to make contact, then please jump on our website and get some contact details off there and get in touch. I'm happy to carry on this conversation and share any more information that would be useful with you.
Definitely. And if you haven't already found John on Twitter, I think you'll find he's on Twitter a lot this week, as always. It's another great way of finding out what they're up to. Thank you ever so much for coming and joining us at the festival today, John. It's been great to hear so much about how the community has really pulled together to help our response in Dorset. So thanks again. And thank you everyone for joining us.
Thank you, everyone. Thank you. It's been a lovely morning.
Thank you.
And thanks, Sarah.
Bye. Take